Millions of seniors are about to accumulate massive amount of medical debt because of the Medicaid cuts as part of the big beautiful bill. Now, whenever I talk about this, a lot of people are like, "Oh, this is clickbait, this is fear mongering, this is not going to happen." So I'm going to show you a chart that illustrates how devastating the Medicaid cuts are going to be for seniors. This is a graph from the Center on Budget and Policy Priorities, and they are looking at the House bill that just passed, and they are looking at an example of just $1,100 in tax cuts that is going to go to people that are making over $500,000. Where is the money going to come from? They identify $715 of that is going to be coming from cuts to Medicaid, and then another $300 is going to come from cuts to food stamps. So think about it. They're just looking at just $1,100 in every tax cut that is going to the people making 500,000, and look at where the money is coming from. That is not all. 11 million people are going to lose their health care, and it's estimated that 16 million people are about to lose Medicaid. Now, here is where those changes are coming from. Policy changes is going to make a lot of people lose health care and put them in the uninsured category, but they're chipping away at everything with various specific policies. So you add them all up, and 16 million people are going to lose benefits. And I'm going to talk to you about who that 16 million fall into, including massive amount of seniors. So they're going to end the expanded premium subsidies on the ACA. Well, that's going to cause 4.2 million people to lose benefit. There's going to be stricter enrollment rules for insurance marketplace, which is the ACA. Another close to 1 million are going to lose benefits. And then they are going to chip away at additional cuts. They're going to cut Medicaid by 7.8 million. They're going to make changes to the insurance marketplace. That's going to lose another 1.3 million. They're going to cut other healthcare insurance program. That's going to lose 2.3 million. And so you put all that together, and the bill that just passed the House is going to cause 16 million people to lose healthcare. So then you're probably thinking, how am I impacted? If I'm a senior citizen, how am I impacted? Well, the problem is that 62% of nursing home and assisted living fees bills are paid for by Medicaid. Another 30% of seniors who are on Medicare are also on Medicaid because they don't make enough money to afford the out-of-pocket costs and even the Medicare Part B premium. And so those are paid for by Medicaid. So when you take Medicare away, you are also essentially restricting people on Medicare and their ability to be able to fully take advantage of their Medicare, because 30% of people on Medicare also depend on Medicaid. Now let's get to children. Half of all births in the United States are paid for by Medicaid. And I did the research, and here are the numbers. In Louisiana, 61% of births are paid for by Medicaid. In Arkansas, 59%. In Mississippi, 59%. Kentucky, 54%. South Carolina, 54%. New Mexico, 59%. Oklahoma, 58%. Georgia, 53%. Indiana, 52%. And Tennessee, 55%. So these are real impacts. So when they're taking Medicare away from people, it is going to have real consequences. I'm going to show you another graph. This is a graph that is from the Kaiser Family Foundation. Now, as I always say, this is not about politics. I'm just reporting what is happening so that you are informed. And then I'm going to give you a number to call because the bill is in the Senate right now, and you can do something about it so that these devastating cuts do not happen. These are the people, additional people whose Medicaid is going to be at risk. On top of the 16 million people who are going to lose benefits, these are the additional people who are going to be at risk. In Wisconsin, 1.2 million, Michigan, 2.4 million, Pennsylvania, 3.1 million, New Jersey, 1.8 million, Virginia, 1.8 million, North Carolina, 2.8, Georgia, 2 million, and Arizona, 2 million. Well, so what does that mean? Why should you care? Well, here's the thing. There's a lot of data that I want to share with you today that is going to give you a picture of why you should care. Medicaid is the biggest insurance, basically the biggest insurance program in the United States. 74 million people depend on it. It's bigger than Medicare. Now, because of these cuts, 1.9 million people will lose access to physicians. 1.3 million people will go without needed medications, and more than 1.2 million people are going to lose access to critical cancer care. Now, Medicaid supports 2 million people with post cancer treatments. I get stories all the time in my feed about people whose cancer treatment would not have been possible without Medicaid. So, 246,000 people will be turned away from care due to medical debt, and 380,000 women will miss recommended mammograms because of Medicaid cuts. Now, I've told you all the little ways that they're going to chip away at Medicaid, but here are some facts you should think about. I told you 74 million people depend on it, and is America's largest insurance program. 1.1 in 5, 1 in 5 Americans are on Medicaid. Think about that. Every 5 people you see in your community, one of them is on Medicaid because 74 million people depend on it. So, another devastating thing that's about to happen is going to happen to rural hospitals. And I am going to talk to you about that because I think this is one of the areas that a lot of us are sleeping on it and are going to be surprised when the cuts really start happening and we realize that our rural hospital that we depend on is losing access. So they've made some tweaks where, as you can see, this is a map and it was something that a senator was presenting at the Senate. So we're able to take a screenshot of it. It shows that Medicaid funding will be forfeited by states over the next decade. Virginia, 24 billion. Louisiana, 20 billion. South Carolina, 20 billion. I know you cannot see this clearly. Tennessee, 16 billion. Kentucky, 12 billion. Ohio, 8.4 billion. West Virginia, 6.2 billion. Missouri, 6.1 billion. Iowa, 4.1 billion. North Carolina, $38.9 billion that's going to be forfeited because of what is happening. And I'll share some details to you so that you can see what is going on here. Now, here is a chart that just shows how much is going to be lost by year just for North Carolina. Loss in hospital receipts. How much money is coming to rural hospitals? $150 million next in 2026, 2027, 450 million the following year, 750 million. You add that all up, is $7.75 billion in hospital receipt. And then federal matching funds that goes to these hospitals that they are losing is 29.1 billion. So total, North Carolina alone is going to lose $38.9 billion. And Medicaid coverage for over 600,000 people could be at risk. So you can see that this is not, we're not joking here. These guys mean what they're doing, and they're about to put a lot of lives at risk in ways that we have not seen before. So this is the complete chart that I was sharing with you that was shared by the senator. So that is what's happening on the Medicaid front. Now I'm going to share with you another chart that is going to show you what's been happening with the uninsured area. This is from The Hill. The Hill published something from the Congressional Budget Office that is showing what's happening with uninsured population. It says Congressional Budget Office, which is supposed to be a nonpartisan section of Congress that scores every bill that Congress is passing. 11 million people will be uninsured if GOP mega bill becomes law. That is the Congressional Budget Office. Uninsured. Now, let me read to you the details of that bill because I want to make sure that you understand what's happening and how this is going to happen. Nearly 11 million people will lose health insurance under the House Republican tax bill, mostly due to Medicaid cuts and Affordable Care Act, according to the nonpartisan Congressional Budget Office. The CBO latest reports that 10.9 million people would be uninsured over the next decade if the spending package, which includes much of President Trump's legislative agenda, were enacted. That total includes an estimated 1.4 million people in state-funded programs without verified citizenship, nationality, or statutory immigration status. The legislation will impose new restriction on states that use their money to provide health insurance for immigrants. I think a lot of people would agree on that. According to the analysis, about 7.8 people will lose Medicaid coverage under strict work requirements. This is where a bulk of the people are going to lose benefits. And millions more will lose coverage through the ACA exchanges. Now, let me explain the ACA exchange part and why that is important. There are a section of people who do not get health care with their employment, and they also don't get health care from Medicaid because they make too much money. So they are in this little gap where they can't get health care from work, they and their family, and they can't get Medicaid because they make too much money, because Medicaid is health insurance for the poor. And it's interesting that 1 in 5 people in America depends on Medicaid. That is 20% of the population. It means that the government is saying that 20% of the population are poor, or low income. Well, that is the government telling you a lot about what's happening. So when they are cutting benefits from this particular population, why do they think that it's okay? But anyway, I digress. What I'm saying is that there's a group of people who don't qualify for Medicaid because they make too much money. They don't get employer health insurance because their employer does not provide health insurance. Their only option to get coverage is to go to the ACA, the Affordable Care Act marketplace, and buy insurance. But market price insurance is expensive. So the government offers subsidies to help you buy insurance. They are taking away the subsidies completely so that you're not on your own. So here is something that they've been saying that is a big lie that you need to pay attention to. They are saying that they are not cutting Medicaid, but they're restricting the growth of Medicaid, and that people who lose Medicaid are losing them because they choose to do so. I have never heard of a more evil thing being said by a politician than what I just told you, that people who lose healthcare are choosing to do so. Well, you are making it more expensive for them and they cannot afford it. That's why they're choosing, because they can afford it. It's not like they have a choice and they saw healthcare and they're like, oh, I don't want it. It's because they had it and you made it more, you're about to make it extremely more expensive. And so they can't afford it. And so I don't want people to be deceived by what's happening. And why am I so passionate about this? Because, guys, this is being done under reconciliation. It's a massive bill that is going to cost a lot. It's going to cost trillions of dollars, add about 3 trillion to the debt, increase the deficit. It's going to reduce how much money the government brings in by about $3 trillion. But here's the thing. This is the only opportunity Trump is going to get to pass a massive bill, because they're doing it under reconciliation and they only need a simple majority in the Senate. It cannot be filibustered. And that's why they are stuffing it with all their wishes. But part of it is the graph that I showed you earlier, because that graph says everything you need to know about what is happening, which is that if you just take the massive amount of tax cuts that people who are in the high income category are going to get, if you take just $1,100 of it and you analyze it, $715 is going to come from Medicaid cuts and $300 is going to come from SNAP. That is not a Senate or a House that wants to help low income and middle income people. That is a House and Senate that wants to take money away from the poor and give it to the rich. Now, yesterday in my post, in my video, I gave you some data about how this is going to affect people's taxes, because they're telling you that, oh, it's the biggest tax cut there ever is, and you're going to get a massive amount of tax cut. But here's the thing, that is also a lie, because independent analysis has shown that people in the low income category are going to be severely impacted by the House bill. And I'm looking for my graph to show you, but if I can't find it, I will share the Senate one with you. Oh, here it is. So let me share that with you first before I share with you the Senate version. So the House of Representatives passed their bill. It's done. Here is what independent analysis showed. If you made less than $17,000, you are actually going to get a tax increase of $820. If you make between 17 to 51,000, you're going to get a tax increase of $430. If you make between 51,000 and 93,000, then you're going to get a little tax cut of $840. If you make between 93,000 and 174,000, you are going to get a $3,000 tax. So it gets interesting if you make $93 and $93,000 and above. You get $3,000. If you make 174,000 to 263,000, you get $5,515. If you make above 263,000, you get a lot more, about $10,000 to $13,000 in tax cuts. So the House version of the bill doesn't help low income people at all. It does not. And so then the question is, where does the Senate bill actually fall? Is the Senate version any better? And is that going to help low income households and families, be able to get, some tax relief? Well, let's look at the data because it has also been analyzed. So let's look at the Senate version. Here is an analysis by, I think, is the Center for Budget and Policy Analysis. If you're in the bottom 20%, you will just gain 70%, $70. That is based on the Senate. So 0.4% in tax cut, $70. If you're in the second 20%, you get $520. If you're in the middle 20%, you get $1,000. If you're in the fourth 20%, you get $2,380. If you're in the top 20%, you get $8,590 in terms of income. If you want to break it down, people making over $1 million get $88,000, $540 in tax cut. The top 1% gets $62,000. The top 10% get $13,000. But what I've shared with you from the House, the low income category is not getting anything. They're actually getting a tax increase. And so what is my point with all this? I think that we should wake up, and once this is passed, once it passes the Senate and the president signs it, it's over. These things are going to happen, and it's going to be devastating. A lot of seniors are going to be put in massive amount of debt. A lot of low-income households are going to be put in massive amount of medical debt. A lot of people on disability are going to struggle. 2 million post-cancer treatments are not going to happen because Medicaid have been taken away from them. So if you want to call 202-224-3121. That is the Senate line. Call your senator. When you call the switchboard, they are going to route you to your senator. 202-224-3121. That is the number to call. Let them know that you are not in favor of what's happening. And look, I am passionate about it, and I am putting this in front of you because I believe that this is wrong. This is wrong, and I think that if we don't speak out now, 16 million people are going to lose benefits, and another, devastating amount of people are going to not have coverage. So I want you to, talk to me in the comment section below. What do you think? I want to bring you facts so that you can make your own decision on what you want to do to help the situation, especially if you are impacted, or somebody in your family that's going to be impacted, or somebody in your community that's going to be impacted. There's somebody in your community that's going to be impacted, even you on your street, in your neighborhood, because 1 in 5 people depend on Medicaid. So that's what I wanted to share with you. Finally, I want to talk about Medicare. We are committed to helping seniors get the Medicare that helps them get the best out of the money they have put into Medicare and are not really getting their value out of it. So we've partnered with Chapter Medicare for a free help. Chapter are different. Why? Because they are there to be your advocate. They want to be in your corner and help you navigate this confusing maze of Medicare. And so when you give them a call on the number you see on your screen, 539-205-2147, they're going to show you Medicare plans that are in your area. Some plans are specific to your region, to your state. And so they're going to show you everything that is available to you. There are 24,000 Medicare plans out there. And that's why 90% of all seniors are in the wrong plan, because it gets overwhelming. But they will walk you through what's available to you, what the copays are, what the hospitals that are in that network, you know, what doctors, prescription drugs are covered, what the copays are, deductible, et cetera, et cetera. And then they'll help you compare that to traditional Medicare. Why? Because that is their mission, to make Medicare simple and easy to understand so that you can get the best out of it. Everybody we've sent to them has had a great experience. They are rated A plus with the Better Business Bureau. Tons of 5-star reviews that we get constantly from people who have worked with them. So if you are not sure you're in the right plan, or if you don't like your plan, or you just think you could do better, call them. But there may be a small window for you to make a change. So call the number on your screen, or go into the description to this video, or in the comments, we're going to pin the form for you to fill out, and they'll reach out to you and help you get the best out of Medicare and save $1,100 a year on average. These guys are the real deal. And I've been doing this for 15 years. I've never partnered with a Medicare partner until now, because I have done the research and I know these guys mean what they say and they say what they mean. So thank you for watching. Let me hear from you in the comments. I'll see you on the next live.